Hi, I'll be talking about Campylobacteriosis. So Campylobacteriosis is a diarrheal illness caused by an infection of the bacteria under the genus Campylobacter. It's the leading cause for gastroenteritis in the world, infecting more people than Salmonella, Shigella, or even E. coli, even though you hear about those other three more often. In 1999, the CDC did a case study in the United States for conditions of diarrheal illness and the bacteria that caused them. And as you can see from the graph, Campylobacter was the leading cause for these conditions, specifically during the summer and the fall months. And the first observation of the bacteria was by Theodor Eschrich, who was a German-Austrian pediatrician observing the stool of one of his patients exhibiting diarrhea. He also saw similar bacteria within kittens who were showing similar signs of diarrhea. It was again viewed in 1913, but it wasn't until 1972 that the bacteria was successfully isolated and then classified as Campylobacter. And this was due to the development in the 1970s of selective media, specifically blood media. Then by 1996, the CDC officially reported that the majority of bacterial gastroenteritis in the world is the result of Campylobacteriosis. The infective agent can be any species underneath Campylobacter, but the majority of cases in humans, 85% to be exact, are from Campylobacter jejuni. Now, this doesn't mean that the other species, though, aren't effective in humans. Out of the 15% of cases, most of those are from C. coli, which is not to be confused with E. coli. And then the others are from different species, C. fetus and C. hyointestiasis, both of which possess similar biochemical characteristics and can cause bacteremia in the immunocompromised. And there's C. laurii, which causes mild recurring diarrhea in children, and C. psaliensis, which causes diarrhea and or bacteremia. But in the majority of human cases with Campylobacteriosis, the the infective agent is Campylobacter jejuni. So C. jejuni is a spiral-shaped gram-negative bacteria with bipolar flagella. The flagella allows it to be extremely motile inside of its environment, which is generally the gut. It's also pleomorphic, meaning that when the environment changes to be less suitable to the bacteria, it'll change its body structure, going from helical shape to a coxoidal shape. In general, this occurs when when the oxygen levels in the environment shift. So it is a microaerophilic bacterium, and when there's too much oxygen, the environment no longer is as sustainable for the bacteria. Depending on the strain of bacteria, the genome sequence can also show different diversity, and some of them even have eukaryotic-like systems. And then, of course, the different toxins also depend on the strains. So different strains will produce different toxins, but in general, they're going to be enterotoxins and cytotoxins. Now, the penetration of gastrointestinal mucus is the first step of pathogenesis. You have the movement through the mucus layer using those bipolar flagella, and then it attaches to the gut enterocytes. The secretion of various toxins will occur at that point, which cause the apoptosis of the host cell. And in general, some of the secretions will be Campylobacter invasion antigens and cytolethal distending toxins A, B, and C. But these are going to depend on the different strains. This will trigger the immunoglobulin production within the body, and specifically AGI. The immunoglobulin A is going to attach to the bacteria and immobilize it. This allows the body to have temporary immunity to the bacteria and the infection. And this is going to depend on the host and the pathogen as well, because in some hosts, as you can see from the right-hand side, like the chicken, there is a benign colonization, which scientists don't actually know, but this means that the chicken will not exhibit symptoms like the human will, even though it has an infection. And 2 to 3 days after the initial infection, abdominal cramps will emerge, and this is also accompanied by fever and diarrhea. The diarrhea will often be bloody. This is a result of the inflammation of the intestines where the bacteria is residing within, specifically the small intestines, the ileum, and the jejunum. And with the inflammation, this causes the cracks and some blood to seep into the intestine. Now, the symptoms can last about a week, but occasionally chronic symptoms do occur, and these are generally within patients that are immunocompromised. These patients also risk the Campylobacter to enter their bloodstream, which is bacteremia. Now, patients with HIV, interestingly enough, are particularly susceptible to reoccurring infections, and homosexual males are extremely high on susceptibility. Now, one other development that is extremely rare is Guillain-Barré syndrome. which is a highly uncommon autoimmune disorder, and it occurs when the body's immune system attacks the nervous system. This will result in muscle weakness and sometimes even paralysis. Now, with muscle weakness and the lesser symptoms, it can last from a few weeks to several years, but most people make a full recovery. Very few people have died from it, and the deaths have been from respiratory and circulatory difficulties. But Campylobacteriosis infections are the most common cause of this syndrome, even though it is still a very rare development. Diagnosis isn't common within human beings, but that is normally because most people recover from Campylobacteriosis on their own. When diagnosis is requested, it occurs through laboratory testing of a patient's stool, body tissues, or fluids. And if any Campylobacter or its DNA is positive within the sample, the patient is deemed to have Campylobacteriosis. And as said before, most of the time the diagnosis doesn't occur because people do recover from Campylobacteriosis on their own. It's very rare that it's very uncommon that people will need antibiotics unless they are immunocompromised, and these are people who have blood disorders or AIDS. In this case, the 8 antibiotics listed here are the common ones given, but there have been an increasingly rapid development of antibiotic-resistant strains of C. digeumi and C. coli, and scientists believe that this is a result of using antibiotics in animal growth promoters, which establish the antibiotics and introduce them into the environment of the bacteria before it even enters a human being, therefore making it less likely to be effective when actually being applied. And the best way to stop Campylobacteriosis is really just to prevent it, because there are so many different measures that you can get from it. It makes it very difficult for there to be a controlled mechanism by the CDC. In most cases of Campylobacteriosis are sporadic and worldwide, so outbreaks occur all over very randomly. And this is due to the fact that infections occur through the transmission of animals to humans, or animal products to humans. And also this occurs through contact of infected animals directly, especially pets with diarrhea, and also the consumption of raw milk and undercooked meat. So in order to try to prevent Campylobacteria, the best method is just prevention, washing your hands frequently, using proper food separation, so your veggies separated from your raw meats, and then cooking your meats completely, so don't be like those people with this new trend of eating raw chicken sushi. That's a bad idea. And then drinking pasteurized milk and treated water, just to make sure that the Campylobacter is no longer within the item that you are eating. And that would be it. Thank you so much.